is Dr. Kim Raine. I am a distinguished professor in the School of Public Health at University of Alberta, and I'm also a registered dietitian. I'm also co-director of a policy coalition called the Alberta Policy Coalition for Chronic Disease Prevention, and that's where the cardiovascular disease connection comes in. I am a researcher, and for most of my career, I've spent the majority of my time as a researcher. And more recently, I have used the evidence found through research to also do advocacy and to advocate for healthy environments that make it easier for people to make healthy choices. As a researcher, my career has predominantly focused on the social determinants of health, predominantly nutritional health because of my background in dietetics. And so I basically look at those factors that are outside of an individual's choice, perhaps, in their environment, such as the food availability that's to them, the cost of food. So, food security is an issue that I've looked at, um, as well as policies that may make it easier for people to make healthy choices. So I predominantly look at how these determinants influence people's behaviors, and then work to develop interventions at either the community level or at the policy level to try to make the healthier choice the easier choice. And this has become even more important over the past few years. I mean, even though I've been doing this work for about 30 years, over the past few years, there's been more and more evidence from the Global Burden of Disease study showing that diet is actually the second leading behavioral risk factor that increases premature mortality in Canada, right after tobacco. I mean, we all know that tobacco use is not good, and but diet has snuck up there now, and is right after tobacco, and it's extremely important for us to understand how our diets have changed, how that may have been shaped by food industry, by marketing, by prices, and how we can change the environment to make it easier for people to eat healthy. From a research perspective, I predominantly do qualitative research to really try to understand people's experiences and how it is that they deal with the food environments that they confront every day. What really excites me about my research is the idea of potentially creating social change. I mean, I started off as a dietitian counseling people to make healthy food choices, and I recognized very, very early on that people's choices were very often limited and restricted by external factors in their lives, whether it be lack of money to purchase a healthy diet, or whether it just be the fact that our social gatherings are all associated with eating, and people find it really hard with peer pressure to follow a restricted diet. And I think over the past several years we've also seen it become more and more emphasis on marketing things that are fast and easy, and can you can and food is available to us now 24/7, and you don't even have to get out of your car to get it. So I am really, really interested in understanding how do we address those things. So like I say, I started off by recognizing that the people that I was counseling for diet were having challenges that had nothing to do with their knowledge about nutrition. And so my graduate training is actually in sociology, applied sociology, and adult education. So I turned into a social scientist from and originally being a health professional. And so that was actually quite unheard of 30 years ago. It's become more and more common now to see people with that sort of hybrid training. And, fields like health promotion created the opportunity for people to develop in those areas. Yeah, so like I say, what excites me is the opportunity to see social change. So, how can we, for example, use policy to make the healthier choice the easier choice? Maybe schools, for example, need to have policies that encourage only healthy foods to be offered, whether it be in a cafeteria or in a lunch program or even for fundraising events. Why do we have to sell chocolate bars? Why can't we sell other non unhealthy treats or healthier treats? So making that healthy choice the easy choice is what I'm really interested in. There's also been some very big policies that I've worked with in collaboration with Heart and Stroke Foundation, both provincially and nationally. We've looked at things like the trans fat bans that has made the food supply healthier. We are continuing to advocate for a restrictions on marketing of unhealthy foods and beverages to children, something that's been in the works for close to a decade now, but we haven't quite made it through yet. Even things like front of package nutrition labeling, there's lots of evidence that suggests that that is important, but we haven't quite gotten to that point of making it policy yet. So that's why I say that idea of taking the research and applying it, and creating opportunities for health is what excites me. Um, as I said, I work in public health. I am very committed to the idea of prevention. I think prevention is where we want to be, in particular with respect to cardiovascular disease, and diet-related diseases. We know that diet works best in a prevention perspective. And so that's why I'm very excited to work on the public health side of things. Um, in terms of any recommendations I would have for you as students to pursue a career in public health nutrition, health promotion, health advocacy, all of those things, or all of those things wrapped up into one, is to follow your passion. If this is something that really excites you, then follow it. There are many more opportunities now to study in this area than there were when I started 30 years ago. And don't be afraid to think about doing your work in a way that hasn't been done before. It's when you have new and interesting ideas that you actually make exciting breakthroughs. So don't be afraid to explore those exciting ideas, follow your passions, study and work hard, and continue your passion towards making the world a healthier place. Thank you.